With gratitude, the CLPNA acknowledges the traditional territories where we work and learn. The CLPNA regulates the practice of practical nursing on Treaty 6, 7, and 8 territories, the unceded territories, and the Métis homelands. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of what is now known as Canada, whose presence continues to enrich our community and whose ancestors have taken care of the land for centuries. Welcome to What is a Restricted Activity, a presentation from the College of Licensed Practical Nurses of Alberta. Before we begin, ask yourself this: do I know what my scope of practice is? If so, how do I know? To understand LPN scope of practice, let's start with the Health Professions Act, or the HPA. According to the HPA, LPNs do one or more of the following: apply nursing knowledge, skills, and judgment to assess patients' needs, provide nursing care for patients and families, teach, manage, and conduct research in the science, techniques, and practice of nursing, and provide restricted activities authorized by regulation. Restricted activities are listed as part of an LPN scope of practice, but what are restricted activities and when can LPNs perform them? Restricted activities are high-risk health services that can only be performed by certain health professionals who are authorized to do so. The term restricted activity comes from the Health Professions Act. As you can see from this graphic, the Health Professions Act provides the overarching framework for regulation. The HPA is the document that restricts certain activities. The HPA has a list of restricted activities in Section 1.3. This list is meant to cover activities performed by a variety of health professionals, including LPNs. For example, injections and urinary catheterization are restricted activities that an LPN can perform. This list also includes health services like prescribing drugs and orthodontics, services that LPNs are not authorized to perform. How do you know which restricted activities you are able to perform as an LPN? To answer this question, there are a few factors that need to be considered. First, we need to look at the Health Professions Restricted Activity Regulation. This regulation was created by the Government of Alberta and is available on the CLPNA website. It lists the restricted activities that LPNs are authorized to perform. It's important to note that even if you're authorized to perform a restricted activity, there are other factors to consider, such as your client's acuity, your own individual competency, the policies and supports that your employer has in place, and the CLPNA's requirements for performing restricted activities. Let's look at how a client's acuity may affect your decision to perform a restricted activity. If a client's condition is complex or there is a risk of negative outcomes, that may mean you have to evaluate and collaborate with the healthcare team before moving forward. Here's an example. A newly graduated LPN has been assigned to a high-risk client who is receiving parenteral nutrition. The new grad has the authorization to perform this restricted activity independently. However, they have never done it before. What should they do? To ensure that they are providing safe, competent care, the newly graduated LPN should consult with the healthcare team for further guidance. The important part of this scenario is that this is a high-risk patient. Although the LPN is authorized to administer parenteral nutrition independently, they do not have direct experience. In this situation, the LPN could ask another healthcare professional who has the competency to administer parenteral nutrition to supervise them. It is also important to consider your own individual competency. By this, we mean your unique knowledge, skills, and abilities. When considering your individual competency, ask yourself if you have been properly trained to perform the restricted activity. If you have been trained, have you performed the task recently? Maintaining your currency of practice is an important part of your individual competency. Ask yourself if you remember how to do the activity and how to perform it safely. If you do not have the ability to perform a restricted activity, you still have a responsibility as a health professional to make sure that the client receives the care they need. To ensure a client receives the proper care, collaborate with the healthcare team to determine if another professional can perform the activity. Or if you know how to do the activity but haven't performed it recently, You may be able to have another authorized healthcare professional supervise you. You can also seek out training to enhance your competency for future situations. Where would you go if you wanted to enhance your competency? The CLPNA offers online learning modules for registrants to support education in many restricted activities. Examples of courses offered by the CLPNA include ear syringing and administering blood and blood products. These modules are accessed through your MyCLPNA login. Additionally, employers may provide education and training to build your individual competence in your practice setting. Let's return to the LPN from the previous example and look at how individual competency impacts the performance of restricted activities. This LPN now has 5 years of nursing experience. They have been assigned to a patient requiring parenteral nutrition. However, it's been a year since they last administered it. Should the LPN administer parenteral nutrition as ordered? As it has been a year since the LPN last administered parenteral nutrition, they should examine their current competency with this restricted activity. If they feel confident in their ability to administer parenteral nutrition safely, they may be able to proceed. However, if they are not confident, they should refresh their education and training or complete a return demonstration if required. Now let's look at how your employer's requirements affect whether or not you can perform a restricted activity. One way to know if your employer supports restricted activities is to look at your job description and your employer policies and procedures. Does your role include performing certain restricted activities? Remember that something that is within your scope of practice in one setting might not be within your scope of practice in another setting. For example, in some settings, LPNs are authorized by the employer to administer medications IV direct, and in other settings they are not. Therefore, it is important for LPNs to be familiar with employer requirements before proceeding. Finally, let's look at the CLPNA's requirements for performing restricted activities. We're going to be looking at the CLPNA's standards of practice for LPNs on restricted activities, advanced practice, and supervision. These standards contain information to help determine the requirements you need to meet to perform a restricted activity. There are common education and practice requirements that must be met to perform all restricted activities. There are also requirements that are specific to each restricted activity, including additional education, supervision requirements, and other factors. Some restricted activities are considered areas of advanced practice. To perform an advanced practice activity, you are required to obtain additional CLPNA approved education and advanced authorization from the CLPNA. Let's look at the requirements in more depth. As mentioned previously, the common requirements that are covered in the standard can be separated into two main categories: education and practice. Let's start with common education standards. All restricted activities require education for LPNs to perform. In some cases, you may have received this education in your entry-level practical nurse program. In other cases, employer-supported training may be required. For example, you may need to learn how to use a certain piece of equipment. You may also need to obtain more formal training or instruction in order to perform a restricted activity. We'll talk about other education requirements in just a moment. First, let's look at the common practice standards for restricted activities. Common practice standards outline the minimum standards and expectations that an LPN must adhere to when performing a restricted activity. This could include getting appropriate authorization, identifying and responding to risks, educating the client, and obtaining informed consent. One important aspect of common practice standards is supervision. Not every restricted activity will require supervision, but some do. What does it mean to perform an activity under supervision? In this context, supervision is the guidance, consultation, and oversight provided by an authorized practitioner. An authorized practitioner is a regulated health professional, such as a physician or a nurse practitioner, who has the skills and knowledge and is authorized by another regulatory health college to perform and supervise the restricted activity. Different activities require different kinds of supervision. There are three different types of supervision for restricted activities. These are direct, indirect, and indirect remote. Direct supervision means that an authorized practitioner is physically present at the point of care when the activity takes place. Indirect supervision means that an authorized practitioner is not at the point of care, but they are on site and available to provide assistance when needed. An example of this is an LPN providing ear flushing or irrigation. In this case, the standards require that an authorized practitioner is on site and available to assist if required. Indirect remote supervision means that an authorized practitioner is not on site, but they are available by phone, text, or other technology. An example of this is an LPN who is performing fetal heart rate monitoring by applying non-ionizing radiation. In this case, the LPN would need to have a physician or nurse practitioner readily available via technology. This authorized practitioner would be able to assist if needed. Now we're going to look at restricted activities that require advanced authorization. If an activity requires advanced authorization, this means that you are required to complete additional training that has been approved by the CLPNA and then receive authorization from the CLPNA's registrar before performing the activity. If an LPN has advanced authorization to perform a restricted activity, it will appear on their practice permit. This authorization must appear on your practice permit before you perform a restricted activity that requires advanced authorization. To obtain advanced authorization for a restricted activity, you must complete additional CLPNA approved education. Depending on the restricted activity, this additional education may be obtained from a CLPNA learning module or from a more formalized program. After successfully completing the training for a specific restricted activity, you can apply to the CLPNA for advanced authorization. We've covered a lot of information in this presentation. To summarize, a restricted activity is a high-risk health service that LPNs are required to have the knowledge, skills, training, and individual competency to perform safely. LPNs are expected to know which restricted activities they are authorized to perform. The Health Professions Act outlines restricted activities that can only be performed by authorized health professionals. The Health Professions Restricted Activity Regulation authorizes LPNs and other health professionals to perform certain restricted activities. And the Standards of Practice for LPNs on Restricted Activities, Advanced Practice, and Supervision establish the requirements that LPNs must meet when performing a restricted activity. If you have any questions about what we've discussed, please contact the CLPNA practice team by completing the Ask CLPNA form found on the CLPNA website.